Good day, this is the COVID-19 update for January 5, 2021. I am Godfrey Brooms, and of course on this program is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's always a pleasure having you. Good morning.
Well, thank you for having me on the program.
Let's start right into it, Minister. As dorm students continue to return to school during the course of this week, are you able to give the current numbers and say how the operations are progressing and if any challenges?
Well, it's a work in progress because we have been working in every region where there's a dorm school. We have been collaborating with the Ministry of Education as the students come back from their vacation and come into the dorms. We have been working to test them. So we are using both the antigen tests and the PCR tests. Those who test negative on the antigen, we are able to then use PCR on them. But this is an ongoing effort that we have in the various regions.
Has there been any challenges?
Not that I know of. We have identified a number of positive students, and as we identify those positive students, we're able to isolate them. So it's an ongoing process. It's not something that is new now to the staff because we would have done that when we first reopened school in 2020. So both the health staff and the education staff in the regions have some experience with this.
Thank you, Minister. Some days ago, the Ministry of Health and some days ago, the Ministry of Health, of course, signed an MOU with UG and the Georgetown Public Hospital Corporation. Do you see more career possibilities opening up or the demand of healthcare workers increasing with the onset of COVID-19, hence the need for more qualified people in the sector?
Well, the agreement that we signed between the the Georgetown Hospital and the University of Guyana is a sort of different agreement. We had a previous agreement maybe a couple of years ago. It was very dated, and we thought of updating the agreement. And this is required because when someone is attending the medical program at the university, they're required to do internship at the Georgetown Hospital. And because of that, if there's no agreement, then you'll have difficulty getting internship space at the hospital. The University of Guyana, as you would know, their medical program is the only accredited medical program in Guyana. And they are due for an inspection this year by the accreditation body, and they need to have a lot of these things in place. So having established a joint committee, and they worked for several weeks on this, a committee made up of Ministry of Health, Georgetown Public Hospital, and the university. They worked on all the different areas of this agreement, and we were able then to finally sign the agreement. So it allows now for the students of the University of Guyana in the medical program to be able to do their internship at the Georgetown Hospital. In addition to that, we have recently received a gift from the Yusupasad Foundation of the Yusupasad Clinical building. And we are going to work this year to make sure that that building is put to full use. The building is a 3-story building. It has spaces for lecture theaters, labs, and so forth. And we have to equip it and put it to use. Now, when students come to the Georgetown Hospital, basically a lot of the teaching is done on the ward or at the bedside. So they don't have dedicated space to do classroom sessions. So this building is going to address that, so they'll have now dedicated space where they can do these classroom sessions. So in addition to the undergraduate program that we have with the University of Guyana, the Georgetown Public Hospital has also many years ago created a series of postgraduate programs. Right now we have about 10 such programs, and we are training people in various specialities. So whether it's internal medicine, family medicine, anesthesiology, surgery, and so forth, all of these we have specialized programs. These generally would be 3 years duration. And so the doctors have been working and going to school, so to speak. And again, there wasn't any dedicated facility available to them. So the new building would allow for this type of training to be done. In addition, one of the things that we've been looking at in the new facility is to establish internet connections so that we can do online teaching. So students, doctors who are part of these programs can be in an interior area and still be able to log on and follow the lectures and be part of the classroom, albeit in a virtual sense, but they will be able to participate. So in that sense, we can extend learning to persons who are also working in the interior. So that's what the MOU is really about. And in it, we have also established this joint committee that would look after the affairs of managing what is captured in the MOU. So the Ministry of Health, we have 3 persons who sit on that committee. Georgetown Hospital, they also have 3, and the university, they have 3. So in all, there are 9 persons. And they have started meeting and working out the various areas of collaboration. The other aspect of your question, which deals with improvement, increase in training opportunities, that's something that we certainly are looking at. There are various modalities in how we can increase training. We have been collaborating with the university to look at their programs and to see how we can get some of our health workers to attend those programs. So the university has a range of programs from pharmacy, radiology, medicine, public health, and so forth. So those programs, we would like to see more of our the health workers attending those. In addition to that, the ministry itself, we have an extensive training program where through our health sciences division, we would run nursing training. So we have the largest nursing training in the country. And we have 3 schools, one at Linden, one in Georgetown, and one in New Amsterdam. And so we offer various levels of nursing training through those schools. We have had some interruptions because of COVID-19 last year, but we have created some hybrid programs where persons come in, they do some sessions in the classroom and others are done virtually. Those methodologies are going to continue because we want to have ongoing training of our nurses. In addition to that, we do MEDEX programs, and then we have a number of other types of programs for other categories of staff, including dentechs and so forth, nurse aid and things like that. So our training is quite extensive, and we'll continue to do that. We have also been looking at how we can upgrade staff to get a better understanding of issues relating to COVID and so forth. Those we would from time to time run virtual sessions. So for example, when we design new guidelines for COVID-19, the treatment of COVID-19, as we update those guidelines by our expert committee, we then run training for all the doctors involved in COVID management. So these are ongoing efforts, and we'll continue to do them in this year.
Thank you, Minister. With COVID-19 in mind, is there any specific program you would want to see healthcare workers attend at UG?
Well, even if UG doesn't have the program, we will design it once we see there's a need. So, for example, one of the things that we have been doing is to do infection control because COVID-19 obviously is an infectious disease, and therefore, if we can have good infection control practices in our institution, then we can limit the spread. And this is something that we have done some training last year, and we have did another round where we sent out staff to all the institutions and we trained people in every region to be able to teach infection control to the rest of the personnel in the region and to observe and to make sure that these practices are put in place. So this is going to be an ongoing effort because sometimes people tend to be a little bit complacent and so forth. So we have to keep reinforcing that. But that's a very important area dealing with COVID-19. The other area has to do with treatment of patients. The treatment guidelines have been evolving as new medication. We learn more about how the medication would work with the particular disease and at what stage it's most appropriate. And new things are becoming available. So as we get this type of information, we update our guidelines, and then we work to update our medical staff so that they're acquainted with what is the latest information. So these are ongoing efforts. And then, of course, part of the management of COVID-19 patients has to do with use of ventilators, use of CPAP machine and BPAP machines and stuff like that, so that the patient can breathe properly and they have adequate supply of oxygen. This type of specialized training, we have run some courses dealing with that, and we'll continue to do that because it's important in the management of patients. As you would know, that we have deployed ventilators to all the regions now, so they have the machine, but if they don't have the know-how how to use the machine, then that becomes a problem. So that's why it's important that we train the doctors and nurses to use the machine and also to be able to manage these patients based on the protocols that we have.
Thank you, Minister. Tangentially, you mentioned that the building donated by Dr. Yesu Prasad will be used as a classroom for interns from UG. What is currently happening at that building?
Well, right now we're working to make sure that we equip it properly and we put it to use.
Thank you. And you would have just reflected on your career in the medical field as well as a former lecturer yourself. Can you say to young people, what can you say to young people to encourage them to pursue careers in various aspects of healthcare?
Well, it really depends on what you want to do. You know, some people would choose different fields, but I guess it's what is your passion. So if you like medicine, fine, you can come and get involved in medicine. Medicine is not just about you know, treating patients. There are so many things that we have seen over this last year, how medicine works in terms of the science. So we have seen a lot of the reason why we have vaccines being available to us within a short period of time, like the Moderna and the Pfizer vaccine, is because you had scientists who were working on designing these vaccines, the mRNA vaccine, which utilizes a lot of molecular biology and lots of other interesting things. So a career in science is really a good thing if we can inspire more of our students to get involved. So you can do the basic science and then decide which area of science you would like to get more involved in, and then you go on and you do your postgrad studies. I think that's important because science is one of the driving factors in terms of development of any country. And you would see a lot of the new research that is happening really you know, creating new fields in science that is going to be important for us as human beings in the future. Medicine itself is going to change. We're moving from medicine where it's one size fit all, to what is called precision medicine, where you have to know a lot about genetics and genomics, and you'll be able to customize treatment to suit the individual needs. So there are lots of new things that are coming. It's in the pipeline already, new fields that are evolving, and it's going to be a pretty exciting time in the sciences. So if anybody wants to get involved in that, now is the time to do it, because there's so much that is, coming on stream, and it's an exciting time for science.
Dr. Anthony, thank you very much for such insightful updates, and I look forward to speaking with you very soon.
Thank you.
This has been the COVID-19 update. For more information, you can visit our website at dpi.gov.gy or our social media platforms.